Good evening and welcome to another informative episode of Health Check. It's on Hope TV where you look and live. My name is Kerry Kagiri and today's conversation is hot. I want to give this some context even as I introduce our specialist in studio. I also, by the grace of God, host the breakfast show on Hope FM. And some of the conversations we had last week, not this week, but last week, was a lady texting in and saying, I'm going to kill my husband, then kill myself, and we cannot do this anymore because we are unable to have children, and the church is in our business, the office is in our business, everybody's in our business, and we've been trying to have children. I am depressed. I am done. So this is a very serious conversation. The conversation is actually on fertility. Now we want to learn, what does it look like before you get to be judging somebody why they don't have a child, or, pestering your partner, pestering your children, your colleagues, your churchmates, your congregants, whatever the conversation is around, why don't you have children? If it's not some of the people who come out and say, I just do not want to have a child, I am not going to have a child. So we're having that conversation with our specialist in studio. He is not new to this set. It's Dr. Wachira Murage. He's a consultant obstetrician, gynecologist. Good evening. Karibu sana.
Thank you. Thank you.
I think what I've talked about is something you've had a lot.
Yes.
Couples being frustrated by people.
Yes.
The pressure externally.
Yes.
Internally.
Yes.
People having it.
Yes.
And it's very serious. And I think, thank you so much for coming to discuss fertility.
Thank you.
We can
Thank you very much.
Pretty much start before even we go to where you practice and everything, because I know everyone will be asking this question as we go on with the show. What is fertility?
Thank you. Thank you. Fertility is inability to conceive or to get a baby. So when you're talking about fertility, you're talking about two kinds of fertility, primary and secondary. Primary is where a lady has never gotten pregnant, even to the point of getting an abortion or getting a miscarriage, nothing. In their lifetime, they don't know what it means to be fertile. Secondary infertility, they have gotten a pregnancy. At least they have achieved, either that current partner or another partner, but at least they have achieved a pregnancy and lost it or got a baby or whatever. That is secondary infertility. So inability to have a baby, and you look at some factors that qualify infertility. You are talking of things like being together, trying, and it's like having being together like about 3 times per week. That is regular, regular intimacy, for that matter, for about a year. When that comes, then you're talking about infertility, inability to have a baby. So when you're talking about fertility, you're looking at that potential of being able to conceive and get a baby or whatever, but to conceive is the issue.
I want you to highlight that there's a role of both male and female.
Yes, absolutely. I know we are in Africa, and we believe, although that thing is going away, that wherever there is no baby in a family, it's the woman, which is not true. I can tell you now, the man's contribution is about 30% into the whole scenario of infertility. The ladies is 40%, and the other 30% is shared between the two. So you can see there is no fertility treatment without the involvement of a man. Yes, so the man is so key. And as we go on with the show, we'll be able to discuss and see what are these causes and how do they relate to the day-to-day activity, and where does the man come in? Yeah, as fertility specialists, we do not treat fertility without the involvement of a man.
So it's the partners.
It's a partner, it's a couple thing. And that should be well understood. It's not the issue of the lady only. The man has to be involved.
We needed a man in this picture. Can we edit it anyway? We get it. Question probably is, when is one considered to have fertility issues?
One is considered to have fertility issues. They come to the doctor. And it's good to mention this because I see some young girls at age 19, 20 and coming into me, doctor, I want to know whether I'll ever have a baby.
I know. I've always been curious. I'm like, how do you know? And I realize having a period every month is not a sign.
And my answer to this is that we able to tell if you can't have a baby, if you've tried over a period of time.
Okay.
Of course, there are some things that are obvious. Like if a lady is born without the features of a girl, for example, maybe the age is supposed to attain their breasts. The breasts are not there. Maybe the hairline. Maybe even the carrying angle, the arms, the hips. So we see they are lacking some features in the development, of that girl. Or if they've ever had some sort of surgery.
Yes.
Or maybe they have had some disease, like diabetes, or maybe some cancer, or things like that. Or they have delayed having their menses. Their age now more than age 17, because we say by age 17, all girls should have at least their first menarche, the first period. After that, we are concerned and we don't want to know now. Unless there are now those obvious signs and symptoms, all ladies should consider themselves fertile.
Okay.
Yeah.
Okay. As we have this conversation, you mentioned hips, and I know there are communities in Kenya who say, that one doesn't have hips. There's no child she can produce. Or, this masguembe. I don't know what you call them. Is there another word for them?
The calf muscles.
Yes.
Yeah.
Hey, without the calf muscles,
Yes.
there's no child that can be
Yes.
produced. So
Yes, there's no child that can produce.
I'd really like to hear your feedback on that. And if you come from those communities, SMS us on 22232. That's a text line. And we should already be receiving your questions. What are some of those questions you have on matters fertility? So I just want you to dispel that myth before I continue with my next question.
What I mean by hips and carrying angle is the feminine looks, right? So if we have a girl, and by age 12, 13, up to 14, they do not have those features, then we are concerned.
Okay.
And we don't look at in isolation. We combine with other looks, and we want again now to do now.
Feminine je ne
But,
sais quoi.
yeah.
Yes. Okay.
That's
Get
the
that.
things, yes.
Okay. Let's talk about some of the causes.
Yes.
And some of the things you can pinpoint directly, because we've talked about what features, what it looks like, but what are some of the causes?
Of infertility.
Yes, of infertility.
Oh, okay. There can be many, all right? And some of the causes, you can divide them into some diseases. There are some diseases that to be associated with fertility, endocrine disorders, diabetes, thyroid disease. But if you want to hit the nail on the head, thinking about infections, and that is the commonest cause of infertility.
What?
In our country.
Infections.
Infections.
Okay.
What we call chronic pelvic disease. Chronic PID, chronic pelvic inflammatory disease. This is an infection that gets into the pelvis of the pelvic of ladies. And we are saying that it's an ascending infection. From the outer private area, they go up to the uterus, and as they are going, they're damaging the organs. And by the time they're out there, they are causing infections, they are causing adhesions, and they actually now block the tubes. By and large, that is the commonest cause of infection.
Let's talk about that a little bit.
Yeah.
Because, I don't think that's been highlighted enough.
Yes.
And even on the show, like you mentioned in that, I'm like, yes, I've heard about chronic pelvic, inflammatory disease, but can you talk about how you get chronic? What did you call it? CPID?
PID.
PID.
Pelvic inflammatory disease.
Yes. How do you get PID?
Yes.
And what would you advise people to stop doing right now?
Chronic pelvic inflammatory disease, or pelvic, or what we call pelvic sepsis, or infection in the pelvis.
Sepsis is such a strong word. I can't imagine.
It's infection. It's basically our term for infection,
Yes.
just to make you understand
Yes,
that there is a... So you're talking of ascending infections, and those infections are coming from the outer part of a woman's organ, and they are going up. I know there's this thing that most ladies raise eyebrows, and you come and tell them you have PID. Then the next thing, they're looking around whether the husband is around, because they think it's
sexually transmitted?
STIs, sexually transmitted infections. Not always.
Yes.
Of course, the sexually transmitted infections like chlamydia, gonorrhea, those ones are really risky in terms of damaging the reproductive organs. They are number one. And most of the pelvic infections are because of those ones. But there's a large group of pelvic infections that are caused by other infections. The normal bacteria in the, in the vaginal region, and they tend to go up. For example, they may go up during periods. They may go up during maybe ovulation, even during birth. Another common time that those infections can set up into the upper reproductive organs is during procedures, like terminating pregnancy. This is now how the morals and the behavior is coming in. Yeah, that those procedures done in unclean environments and doctors and health practitioners who do not know how to do and they are not licensed. Yeah, the backstreet clinics and all those. Yeah, those ones form a large part of the pelvic infections that damage the organs. So the infections that you're talking about, you're talking of either sexually transmitted infections, which form a small group, and the other normal bacteria of the reproductive organs that are set up into the other upper parts of the reproductive system during those particular moments.
Wow. Okay.
Yes.
So what about like cleanliness? Does it have anything to do with it?
Yes, it may have a role.
Because I've heard the organ is a self-cleaning. When you're talking
Yes,
about a woman.
yes, it may have a role, but you'll find that most ladies are very clean.
Yeah.
Yeah, most ladies are very clean, and therefore, what sometimes can cause a problem is douching.
Yes.
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 Yeah, and this is a habit that we discourage.
Why do they sell douches? That's
Yes,
what I wonder. Why
yes,
do they
yes.
sell douche?
Because people have a notion that their inner parts are unclean, and therefore it's easier to convince them that along the day you may have some odor coming out, which is really not true. If there's really an odor coming, then you need treatment.
That's true. You need to go to a gynecologist.
Yes, and let me mention this because over the last few weeks I've gotten ladies coming to my office and say, "Oh, Dr. Look here, I have a very bad odor." And I tell them, you have come into my office. I didn't feel any odor. I didn't perceive any odor. Because a bad odor from a lady should be like when you're coming to the doctor's office.
You smell it.
You should be able to smell. In fact, there should be even a fly following you up showing that there's really some infection.
Yes.
Everybody gets some bit of odor towards the evening because they've been busy running around, so they're sweating and all those things. And that is acceptable. And unless someone comes very close to you, that's when probably they may get some odor. But if they keep the distance that we are in, there's really no odor. So those douches should only be mentioned, be condemned.
Okay.
And they can actually cause that. For the men, because men sometimes we think they do not have infections. They can now get testicular. In the testes, they can have like gonorrhea, can damage the testicles. Diseases like syphilis, chlamydia as well, can damage the testicles. And therefore, block the tubings in the testicular, even damage the testicle, which is now the factory of the sperms. So when that happens, also they can get that. The other thing that can also lead to the infections in the man, because we said fertility is about a couple.
Two people.
It's not one person. And whenever one person is considered and the other is left out, that treatment has problems. It takes longer, it's more expensive, and many a times it does not succeed. So for the man, again, they can have now their tubes, the seminiferous tube is blocked by infections. And when it is blocked, then the sperms, when they're supposed to come out, they don't come out because they are blocked. And that can cause infertility in the man.
So there's no ejaculation?
There is some bit of ejaculation, but the pipes that now are supposed to bring in the sperms.
Yes, got it.
The ejaculate is a summary, component of many ingredients, and sperms being one of the ingredients. So I'm talking about the sperms, the tubes that contribute, that bring in the sperms are blocked.
Okay.
Yeah.
Wow. The conversation is on fertility, and we're using the word fertility because using the word infertility, really, we're going to use it somewhere, but that's a conversation we're having. If you have any questions, you've been wondering, you've been struggling, we have a specialist in studio and he is ready. Dr. Shira is always so amazing to answer all your questions. We're looking forward to your feedback. We're looking forward to any myths, notions you might have. We want to cancel them out and give you that peace of mind. And also, for you to be able to support your family, your relatives, your partner in the right way. There's this thing that has come up called vaginal. Vaginal. So it's like a facial, but for the other organ.
Oh.
So I think we cancel it with the douching as well.
Oh,
It's like a facial. You know what they do in the facial? Like they steam your face.
Yes,
then
yes.
They put
Oh,
a
yes,
mask.
yes.
So they're
yes,
doing
yes.
the same thing on the outer
On
area.
the outer area.
Yeah.
It is not necessary.
Okay.
And all those procedures are there to hurt the God-given organs.
Yeah.
And people should not,
Awesome.
do those things.
When we go to diagnosis of
Yes.
fertility, what?
Yes.
I think you said trying and trying and trying.
Yes. When we are talking about infertility, and a lady come or a couple comes, and you're supposed to make a diagnosis of infertility, you start with the history. And the commonest history is, doctor, if it's a single lady, I had this husband of mine, we said for a whole year, we tried for a baby, and then he decided to go away. And I'm told wherever he went, they have 2 children, or whichever kind of a history that you get.
Yeah.
A history of, we're looking at 1 year, someone trying consistently. Others come and tell me, I've been trying for 6 months, 4 months, and that's not enough. You need at least to go for a year.
Okay.
Because the chance of getting a conception every month is only about 25%.
Every month?
Every month.
Okay.
To make it easy, I'm saying if 100 couples are starting in the month of July, only 25% of them will achieve a conception.
Wow.
The other 75 you'll try in August. 25% of that 75
will get in August. Yes.
So we have a small percentage of people that do not achieve fertility in 1 year.
Is it God just organizing the universe?
Well, it's really a very delicate process.
Yeah.
So you can imagine the sperm is coming up, the egg is coming, there's fertilization, there's implantation. The whole process is a very, very delicate. And sometimes, there might be a mismatch between the time the egg is available, the sperms are coming, and maybe a couple may not have time. When you consider all those factors, they contribute to the chance of having a conception, at the end of a whole month. That's why it's very, very reduced. And that's why we encourage that regularity. So there's a bit about history. Been trying to get a baby. And that's why we are not keen in trying to investigate a young girl who comes because they're anxious. And they say, oh, look here, doctor, I just want to know. Of course, if you insist, there are some tests that you can do. You can do a whole
egg.
Endocrine organs, diabetes, check for cholesterol,
okay.
do ultrasounds, and if they are really keen, you can check the hormones, look at the ovaries, you can do all that. But normally, if what is said, a lady has no history of surgeries, no history of trying before, they don't have any medical, medical issues, we really don't hurry, because that's the kind of history that we are looking at. From the history, then you can go to investigations, right? And a man as well. They'll say, okay, I've been this lady, and they came in with a baby, or we're in this relationship, we've been trying. That's kind of similar kind of history. Or if they come and say, I had mumps, because mumps also in men is a major cause of infertility. The mumps virus destroys the testicles. They get otitis. Or they say, doctor, when I was born, my testes were not dropped.
Yes.
And descended testes.
Yes.
They were up there. And therefore, they were overwhelmed by the environment. Because why as men we have the testicles floating? Is because we need them to enjoy the variations in temperature. We don't want to be very hot, because the sperms, the cells for spermatogenesis, for making the sperms, we die off. Okay, so that's why the testicles should be floating. If they hang up here, because ideally, for all the boys, when we are born, when you are very young in your mother's womb, the testicles are up there.
Yes.
So by the time you are born, they should come down. Okay. To the testicles.
At what age or at what point do they come down? In case someone has a baby boy, and the doctors will notice already and say something about it.
By the time the boy is born, they should be felt.
Okay.
In fact, those are some of the things that the pediatricians. So now baby boy is born, they go to the testicles and check. So that in case they don't feel that there's the small testicles, then they can do ultrasounds to see whether they are hanging in the canal. There's a sort of a canal here called the Gynaecologist canal. So that if they're still hanging, then some surgery should be organized very, very quickly. Yeah? So that you drop
parents
them
have
up.
a huge role to play in the future of their children's future.
Yes, that is very, very important. In fact, mothers know it's sort of an instinct.
Yes.
Yeah, if the doctor fails to check, they always, when they are low, they go and palpate, and
Even
feel.
mother-in-laws.
Yeah, all of them. They check and make sure. So such things. All had a man maybe had pus coming out from the external organ because of diseases like gonorrhea, chlamydia, trichomonas vaginalis, all those kind of STIs. Or have they ever had a sore in testicle?
But who will say that?
Yes.
Ama they'll tell it to the doctor.
They'll tell it to the doctor.
Okay.
Those are the kind of history that you're looking. You said what you look at in the lady and the kind of history we expect. Now this is the kind of history you're looking at in the man. Yeah. Have they ever had painful testicle? Because there's what we call testicular torsion. Yeah, the testicle is kind of it's hanging and there's sort of like a stalk. That stalk sometimes can twist.
Oh no.
If it twists, then it damages the testicle and it can actually die off. Yes?
Wow.
Right? Testicular torsion, a very common cause of this. So these are the kind of histories. Yeah, social. We want to hear history of social history. Drinking, smoking, mirror. Yes? All those. History of drugs. We want to hear all those kind of history. And from there, we're able to form an opinion that, this is contributing. Before that, and history is very, very important. That's why we encourage the listeners and people suffering from infertility, go as a couple, give the whole history. Don't leave anything behind because some things can be important. I know most men will try and say, I only have a drink. Yet they know they take drinks and drinks. I only have a smoking one stick, once in a hour socially.
Or I'm young, this is the time I need to do this thing.
Yes, and they know they have a whole packet. They need to bring out because smoking is a major cause in male infertility, fertility issues in men.
How?
Smoking, because it damages the cells, it causes poor blood supply to the testicles and all that. It's a major thing. So once you have that, it's now time to go to the investigations that you do. If you look at a lady, the basic test that we try and do is an ultrasound. We want to do a pelvic ultrasound. Look at the ovaries, look at the uterus, all right? And then we want to do another very painful one that the ladies know by name. It's called a HSG, hysterosalpingography. It's a kind of a test that they check the cavity of the uterus. They go to the cavity of the tubes. They want to see whether there's any blockage.
Never heard of it. Wow.
Tends to be painful because the doctors, the radiologists are pushing some kind of dye, some kind of material, and is a radio-sensitive material. So they want to do an X-ray on that material and see how is it going, so that if they see that it stagnates at one point, then they know that definitely there is a blockage at that point. If the lady says, okay, my periods are very irregular, I've never had my periods, then you do hormonal profile. You look at the hormones, yeah? Then you look at things like diabetes, cholesterol, you do pap smears, all right? When you're looking at the man, you do similar tests. You want to do testicular ultrasounds, you want to do hormone tests, but the basic test in a man is seminalysis. You want to check the sperms. In fact, in the most important test when you're looking at fertility issues, sperm count, seminalysis. Yes.
For girls when they come in, I just thought about this question. When's the right age to freeze some eggs?
To freeze? It depends on their plan for fertility. It's a new culture that is now coming, yeah? And many girls would say, I want to have my eggs. I want to give my eggs. Unfortunately, some girls are freezing for sale. Okay? But remember, from age 15, as long as menstruation sets in, then they're producing eggs. Then you can freeze them at any point.
Okay. What's the oldest?
We are looking at, right now, we are very keen in saying from age 40 and above, the eggs are already old.
Diminishing. Are they diminishing or they're getting old?
Both.
Both. Wow.
Both. The quality
Yeah.
of the eggs from age 40. In fact, the IVF specialists will always advise from age 40 and above,
You get
a
egg.
donor.
Yes.
Yeah, get a donor.
Wow.
Donor egg.
The conversation today is on fertility, and when we come back, we'll be discussing common fertility problems that we've seen: fibroids. Is it fibroids or fibroids?
Fibroids
And fertility. We'll be talking about that. Also getting to all your questions. I want to thank our doctor in studio, consultant, obstetrician, gynecologist, Dr. Wachira Murage, always here to inform us and make sure that we understand all there is to know about fertility. We also kind of see the mysteries of God, because there are people who didn't even time, they didn't even think, they didn't even, go with the calendar still ovulating. Let me at midnight, the people who've never done that, and they just ended up having children. So these mysteries, it's such a bit. Does it baffle you?
Yes, it does.
It's actually quite a beautiful mystery. So we'll be talking about that and much more right here on Health Check. It's on Hope TV, where you look and live. Let's get to inform you a little bit, and then we'll be back. Your questions to 22232. Looking forward to respond. Only God can turn a...
Welcome to Activate.
Alarms ringing, get up, hey. It's a good morning.
It's a good morning. Good morning.
Kickstart your day with George and Kerry on the Sweet Hour of Prayer.
And welcome to Activate, this being the station where you listen and live Hope FM.
From Nairobi to the world.
Great music just for you.
Activate.
The only show that keeps you activated.
Yes, indeed.
Activate every weekday morning from 5 a.m. to 9 a.m. Only on Hope FM, where you listen and live.
It's a good morning.
For unlimited, uplifting, powerful worship, only on extended worship.
Searching for answers far and wide, but I know they're all searching for it.
Welcome back to Health Check. It's on Hope TV, where you look and live. We are so grateful that you choose to watch Hope TV, and we plan to always keep you informed as we keep you entertained, but also as we bless your soul. Today's conversation on Health Check is about fertility, and it's one of those hush-hush questions. They've been married for, even some people, they've been married for 6 months now. One has signs. Can you calm down? It's not magic. It's not the wedding ring that gives you children. I think it's actually a very amazing process of God. And I have with me in studio Dr. Wachira Murage. Thank you so much for coming. Consultant, obstetrician, gynecologist. Where do you practice?
I do practice at Savannah Hospital
Yes.
in Upper Hill
Yes.
on Mara Road, and also at Kenyatta National Hospital.
Absolutely. And you've delivered many babies.
Oh, yes, yes.
Do you keep count?
Lost count.
You lost count at some point. I know when you started, you were like 300.
Yes, yes. Now I lost count.
Thank you so much.
I'm only introduced by the moms when you meet on the streets, in the supermarket. Oh, these are, come and say hi to your doctor. They're looking at.
Oh, that's so sweet.
Yeah, it's
But
good. It's a nice feeling.
awesome. Yeah, it must be. And as we talk about fertility, I read somewhere, and I don't know how true this is, that the egg actually chooses which sperm to fertilize it.
Not true.
It's like it's like not good quality, not smart enough. Like it literally
it's
picks.
it's normally random.
It's random.
It's random, yes. Because what happens is that the sperms are released in the private, the outer private area of a lady, and then they swim up. There's normally a sort of a
race.
competition.
Uh-huh.
It's a race.
So it's the strongest one.
Yes, and the sperm that goes in a vertical is the strongest, the swiftest, is the one that gets there. Once it fertilizes, it's a process called capacitation. It kinds of blocks the rest. So the rest you just find,
Yeah.
the trophy has been taken.
Oh, okay, that's quite interesting.
Yeah, so the ones that maybe form twins, you can have like two almost going together, you know, and then they can arrive at the same time and fertilize at almost the same time.
Interesting. That's
Yeah.
for what are they, twins who don't look alike?
Fraternal
Fraternal.
twins.
That's for
yeah.
fraternal.
Yes.
Okay, the other one, I think the egg breaks on its own.
It breaks. Yeah, once it's fertilized, then it is separated
Yes.
into two.
Yes.
Yeah.
Okay, quite interesting. I listened to my biology teacher. Thank you very much.
You can see.
That was a very interesting lesson. I can never forget that. I said when we get back, we will be looking at common fertility problems and we'll be answering all your questions on 22232. I'm going to start picking them right now. But first, let's pick up. What are some of the commonest fertility? Yeah.
The fertility issues. The commonest, and if you have to look at them, what you really look at in fertility and the commonest cause and what as doctors we like looking at immediately when a couple comes is history of infections in both infections. And here we like putting a caution. It's not sexually transmitted infections. Yes, they form a part, all right? But infections, history of infections. We are talking to the lady and asking, have you ever had any chronic pelvic pain that takes you to the doctor every other time? Any foul-smelling discharge, yellowish, blood-like, all right?
Ever.
Have you ever been treated by a doctor and told that you have pelvic inflammatory disease, pelvic sepsis? Have you ever had any surgery in the pelvis? Because surgical procedures like appendicitis, surgery to the ovarian cysts, ectopic pregnancy. Have you ever had any ectopic pregnancy? Because those are surgeries. Any pelvic surgery in a lady will put a red flag when it comes to fertility problems.
Absolutely. Let's explain ectopic pregnancy, the pregnancy that happens in the fallopian tube.
In anywhere else apart from the uterine
uterine.
cavity.
Okay, yes.
But now when you're talking about fertility, you're saying it's either in the ovary or in the tube. Yes.
Okay.
Can cause that. For the man, do you have any history of the social behavior? Smoking is a major problem.
Wow.
Drinking is a major problem. Those are the issues now. And now we do not understand whether it is the dietary changes because we seem to have an upsurge of male fertility problems.
Wow.
There's an upsurge, which we do not understand. Is it the lifestyle? What's happening?
Yeah.
But definitely the smoking, the Murage chewing, the alcohol is contributing. And of course, now also in the men is the infections. Yeah, that they tend to get. And then for them is history of moms, yes, and history of any surgical procedures, around the reproductive system. Yeah.
John from Kisumu is asking about pumpkin soup.
Yes.
It's going to boost his chances?
Well, I don't think so. I don't think pumpkin soup will boost.
Okay,
Yeah.
okay. I've had watermelon though.
Yeah, people talk about many things, and,
Be healthy.
but we just say like you have summarized it.
Wow.
Balanced diet.
Let's go to your questions because the questions are piling up and we still have our own questions that we need
Yeah.
to go through as we continue.
Yeah.
Let's look at good discussion. Ask Dr. Wachira what causes one to have a baby, then struggle to conceive again. It is distressing.
Yes, we have had ladies who come and say, Doctor, I have stayed for a whole year. I cannot get pregnant. My first pregnancy was, I didn't even have to think about it. I just realized that I was pregnant and I don't have to. But now, doctor, I've been trying since January, it's now December. We simply go back to the same old story. We want to evaluate the couple.
History.
We want to take history. Has something happened in the process of time? Because those are two different events. The events that was so quick, and now these other events that are delaying are two different, and there are two different reasons. So you must evaluate that couple if they have stayed for 1 year trying to have a baby. Yeah.
Wow. Hello, I aborted in 2018. And I also started taking herbal tablets for family planning. Now I have tried to conceive for 1 year and a half with no success. I have tried to use Clomid too. I don't know what Clomid is.
Yes.
What I get now are heavy periods. I performed an x-ray where the doctor said that my womb was clean. What would be the problem and what should I do?
You see, that's really a perfect, kind of a scenario that we get all the time. Having an abortion is one risk factor. Tube blockage. You said that he did an X-ray of the womb, so I don't know whether it's a scan or they did the HSG that you talked about earlier to check the tubes, because terminating a pregnancy or having those procedures can introduce infection and therefore cause pelvic infection and can actually block the tubes. The other thing I would like to mention to the listeners: do not try those Clomid and those treatments. If you have tried
What
for a
is
long
Clomid?
time, Clomid is a fertility drug.
Okay.
It enhances egg production. Every cycle woman will produce either one egg from one ovary or the other, or two.
Oh, wow. They
maximum.
can both come from both sides?
Yes.
Ouch.
Yeah. So now you're saying when you use the medication, then you have overproduction, what's called polyovulation. The eggs will be very many. And sperms come in millions. Yeah, so when you're using Clomid, you're enhancing fertility. You're increasing the chances, because instead of having an egg or two maximum naturally, then you can have maybe 5, 6, 7, 8, and therefore the sperms are coming in
They
millions.
have options.
Yeah, they have absolutely. So what you're saying is that don't use those drugs. If you have tried, have a checkup first. Yeah, because you could have to block it like her. I would recommend that she has a HSG first.
Okay.
And not leave the man behind. There are many instances that we get double pathology, double problems. The man either has reduced sperms, reduced motility, low numbers, and the lady has both the tubes that are blocked. So we always will like working together. Yes.
I'm curious now that you mentioned low numbers. They're already millions. What is low numbers? 100,000?
You're talking over something less than 50.
Less than 50.
50 million, 40 million. So you're talking of 20 million, 10 million. Those are low numbers.
Oh, interesting, interesting. Wow, many questions are popping in. Let's go. Health check. What causes yeast infection and BV? How can they be treated? What is normal color discharge? Can they lead to infertility?
Clear is the color
Okay.
for normal discharge. Should always be clear. Fungal infection is a normal, what you call fauna and flora, is a normal organism of our bodies. In fact, it keeps other bad organisms away. There's normally a balance between the fungal and the bacteria in our bodies. When you do take antibiotics, that's another question that I would like to mention in this particular forum, that antibiotics should only be taken if there's an extreme need, because irrational usage of antibiotics is the major cause of recurrent fungal and candidiasis, yeast infections, because they'll keep taking antibiotics, and the fungal keeps on growing. Bacteria vaginosis is also another. It's a bacteria called Gardnerella vaginalis. It's a bacteria that can cause. They do not cause infertility. Those are just normal bacteria and fungal that
Absolutely.
occur in our bodies.
How can they be treated?
There are treatments. If it's fungal, there's antifungal.
Pellets, like
yes, to
white ones.
insert. You can insert, or you can even swallow.
Yeah.
depending on your preference.
Okay.
And BV, bacterial vaginosis, there's some sort of antibiotics that you use. And they're quite
Healthy
clear.
antibiotics.
Yes,
Okay, so normal color discharge is clear. Sometimes
clear.
when you're ovulating, there's like whitish. Just
There could be whitish is fungal,
Yeah.
but it's sort of clear
And not
whitish,
smelling.
not smelling, not excessive, okay, not bloody, okay, not pus-like, not greenish. Yes,
okay.
yeah.
Ah, wow. Can they lead to infertility? We said no.
No, they don't
Okay.
cause infertility. Yes.
Another question we have out here. This is on our text line 22232. Keep them coming. We are ready. We are here for you, and we're going to be picking up your calls as well. Hello Hope TV. In 2016, I had fibroids removed via CS. In 2018, I had an ectopic. In 2020, I had a miscarriage at 4 months. Up to now, I have not conceived. I am 42 years. Is there any hope for me to get a baby?
There is hope. You should not be discouraged.
You are on Hope TV.
Yes, you're on Hope TV, and therefore there is a lot of hope.
hope.
You just need to be checked. The fact that you had an ectopic pregnancy means that you could have pathology in the tube. And if you get pathology in one tube, there are chances that you could have pathology in the other one. First and foremost, how we treat ectopic pregnancy most of the time is that you remove a portion of the tube. Therefore, okay, so that's kind of now, because it's like a blockage. Yeah, by way of treatment, you
But now
cause
through the
trauma.
other tube.
So this is the other
alternately.
tube. So you need to check the other tube.
Yes.
Yeah. Is it blocked or not blocked? The loss at 4 months needs to be checked thoroughly, because most of the miscarriages, most of the pregnancy losses occur before 3 months. If you find a pregnancy staying till about 4 months, 16 weeks, so it means the pregnancy was okay. So maybe what was the issue is the cervix. Maybe it was loose. So that also needs to be checked. For her, so she needs to be checked the tube and again to check the cervix, whether it is incompetent, and not to forget the spouse as well.
Absolutely. I wish you the best. I think this will be a story for us to celebrate. So
Yes,
you're gonna be fine. You're gonna be fine. I see. Can fibroids history cause infertility? And this is where we were going. Please talk to men to get treatment for infections, because wanasema ni ugonjwa wa wanawake. That's Fatma. Fatma amekuja leo. So let's talk about that. Let's get to fibroids. Fibroids. Everybody is saying, let's get there. Let's get there. Daktari, fibroids and fertility.
Fibroids and fertility. I always say when you're looking at cause of infertility, fibroids almost come last.
Yes.
They always come last. And the kind of fibroids that you're saying that can cause fertility are the submucous. The submucous you're saying is the intracavitary fibroids, the ones in the cavity. That's what you call.
Where the baby is supposed to be
where the
attached.
baby is supposed to be attached. Those ones are the ones that most of the time cause fibroids. The others that can cause infertility is the entry point of the tubes. They can cause compression. Yeah, they can compress.
They are big.
Yes, they are big, or they are near the cavity of the tube, and they can actually compress. Yes. Otherwise, when you're looking at, before you think of fibroids, and this is what we say, if a young lady has fibroids, they could be large or whatever size they are, and they do not have a baby, we try and discourage operation for fibroids. Yeah, because sometimes
The damage that might occur.
yes.
Yeah.
Yeah. You might even, a lady might even bleed, and you end up removing the uterus. And we know that fibroids are not cancerous. And we know that ladies can have babies, can even carry twins with fibroids
Yeah.
of quite a
I
very
have a friend
big
who's gave
size.
birth to
Yes.
2 babies, and her fibroids are the size of an apple.
Yes.
Yeah.
Yeah. So there's no hurry in trying to convince ourselves that fibroids are causing infertility. It's in very, very rare occasions that we find fibroids causing infertility. And when you do that HSG, the one we said is painful, you're going to pick out the fibroids if they're in the uterine cavity. And also good ultrasounds and something we call hysteroscopy can pick out fibroids that are in the cavity and can actually even be removed without having to open. Yeah.
Yeah, absolutely. Well, be encouraged, because fibroids, one of the things that really even doctors haven't understood yet. I have tried to do as much research, like, where do these things come from? Why? Are they there? Okay, we'll keep having that conversation. What about my husband getting semen-like fluid while urinating, especially when we have stayed for some days without having sex? No pain. When he feels like urinating, it's sperm-like fluid that comes out. What could be the problem?
Sperm-like fluid coming out
When he feels like urinating.
when like urinating is
After they've not had sex for a little time.
for some time. And is it during the night? Is it during the day? I know she has not specified. Yeah, because there are things we call nocturnal ejaculations.
They're
Yeah,
called what?
for nocturnal, like at night.
Is it wet dreams?
It's sort of.
Okay.
Yeah, sort of.
But
So that
things don't stop at 14.
they still go on for such who have not had the activity for some time.
Okay.
But I don't know what would cause that, and they need to clarify more.
Yeah.
Is it the for urine or something like fluid coming out when they want to pee when they have not had sex? Unless it's the nocturnal emissions, there are things called like that.
Yeah.
Yeah, when that has not happened for some time. But anyway, having said that, I don't think it's a big issue.
Yeah.
Yeah.
Okay.
Big issue.
If it has affected you in any way, please let us know so that we can be able to give more details. Hello, Dr. Wachira. I'm 37 years. Can you recommend a non-hormonal contraceptive? I need one that doesn't change my body size and emotions. That's Julie.
Okay, Jury, the only good method, which is non-hormonal, is a coil. Yes.
So
the,
how is
the,
coil non-hormonal?
the copper, because it uses copper. There are two types of coil. There's a copper-based, there's a hormone-based. Copper-based is now impregnated with copper. So when it is put in the uterine cavity, the way it works is that it causes sort of like a sterile reaction, yeah, that disturbs the environment. So when the sperms come, they are not able to crisscross that area because there is the metal causing an unfavorable environment there. The hormonal coil has hormone, which now works on the cavity. Sort of causes like a dryness or like a wall around there, yeah, in the cavity. But the unfortunate bit about the hormonal contraceptive is that the hormone can actually make its way into the system and now cause the undesired effects that she does not want. So the only safe one, really, and a good one, is the copper-based contraceptive, the IUCD coil.
Wow. Okay. Health check. I'm 6 weeks pregnant and I have painful cramps at the lower abdomen. I've gone for a scan, but nothing is seen. What could be the reason for the pain?
6 weeks pregnant, said because we think ectopic. Any early pregnancy, the first thing that you want to clear out of your mind, early pregnancy, with the pain, especially at 5 weeks, 4 weeks, it's ectopic pregnancy. So you said nothing was seen. I hope the pregnancy is in the uterus. Now you start thinking of now urinary infections.
Yeah.
They are also
At the lower abdomen.
Yeah, the lower abdomen. Sometimes also you can have a bit of pain in early pregnancy, or what you need to have to her doctor to give you some progesterones and some painkillers, and they'll be okay. Once they have ruled out urinary infection, check also whether she has fibroids, because sometimes fibroids can be a little painful during pregnancy. Yeah.
Also, we talk about ovulation problems. What are some of these? And if you just joined us, Karibu Sana, you're on Health Check. It's on Hope TV, where you look and live. The conversation today is on fertility, infertility. We're talking about both partners being very responsible and playing a role. If I can remember what Daktari said as we started, the lady 40%, the man 30%. Hiyo 30 ingine inacheza hapa na pale na pale. So everybody should be present and active when any of this conversation is going on. Let's talk about that. Ovulation problems.
Ovulation problems. Yes, ovulation is the cornerstone of conception. Because without ovulation, then you're saying that there is no conception. Some of the ovulation problems, and very, very common, are things like polycystic ovarian disease. It's basically an ovulation problem. Because what are you saying is that those cysts produce sort of a male hormone, some androgens that interfere with ovulation. Then you can have other ladies that have ovarian failure for some reasons, okay? Either they have had some drugs, yeah, like cancer drugs that can cause ovarian issues. Maybe they had radiotherapy. And others have unexplained ovarian failure, yeah? There are ladies who are born with underdeveloped ovaries. called the Mullerian agenesis. The ovaries have not developed. And
So how do you
therefore,
tell this at that stage?
these are now the ones we remember we are talking about feminine features.
Yes.
Yeah. Some of those ladies lack those key feminine features, especially the breast development. They're still 16, 17, but the chest is flat.
Or do they get like
And
beards?
the beards are polycystic ovarian disease now. Yeah, the beards, the acne, the irregular periods, the obesity around here, the what we call central obesity, that's polycystic ovarian disease. There are others, like I would say, and this is also a very common cause of ovarian problems, weight loss, weight gain. Yeah, excessive weight gain causes production of other peripheral hormones, the hormones from now, the excess fat. They produce hormones that come and disturb the normal cycle. If a lady like the athletes, who are always stressed and running and they have no enough fat in their body because they burned everything, so they have no substrate to form hormones. Yeah, because hormones are also made from the body tissue, the fat and all that. So they are also very thin, they have ovarian issues. Stress, yes, lots of stress. Again, they counteract that axis. Remember, ovulation is a complex system from the brain to the ovaries and to the uterus. That also causes that. Traveling, changes in weather are common. And of course, our other drugs, like now the contraceptive drugs, the hormonal contraceptive drugs can be a cause of ovulation problems.
Absolutely.
Yeah.
You talked about hormones, and we just get a little bit into hormonal imbalance.
Yes.
Is this both for men and women?
Yes, it is.
Okay.
Yes, so commonly in ladies, so that you have the hormones being disturbed, yeah, so that they do not interact. Because for a lady to have a complete axis, a complete system,
Yes.
the hormones must interact.
So this
at
cycles for
ovulation.
the
Yes.
luteinizing hormone to
Yes.
the estrogen, to
The estrogen, the
progesterone.
follicle-stimulating hormone,
Yes, or
and which
follicle-
hormone is best where,
Yes.
mid-cycle, where you have a surge, and after that, the reduction. Those hormones have to have that very intricate interaction. If it doesn't happen, that's what now is loosely referred to as hormone imbalance. Yeah.
Absolutely. Can you tell this? What are some of the signs of hormonal imbalance?
Most of the time it's irregular menses.
Irregular menses.
Irregular menses, they come in, the periods are just haywire, or the periods close shop. They disappear. Yes, those are some of the causes of hormone.
And for men, can you tell?
For men, really, nothing much that you can tell. It's only when you do the investigations. That's when you can get that. And then, of course, when they are not having, they are not able to sire a baby with a lady, then you do, you check the sperms. Either the sperms are not available, or what you call azoospermia, or maybe they have low numbers, weak, and all that. When you do the hormones, and you find a sort of hormones, the testosterone hormones and other androgens are not there.
Absolutely.
Yeah.
Is there like no features in men as well? Because you talked about women.
Nothing really, but some of the features that you can look at is some men may have what we call feminine features. The breast, what we call gynaecomastia, such. Acne, all those things sometimes may, but when you're really looking at hormone imbalance, normally with the ladies because they have more hormone interactions
Absolutely.
than in men.
Absolutely. Conversation on fertility. We want to welcome you to call live. The call line is right below the screen, or you can continue to send in your messages anonymously on 22232, and you can ask me not to read your name in case you're sitting with your partner and you're trying to text quickly. So we'll keep it private. As we do that, you've talked about hormonal imbalance, fertility problems. Earlier on, we talked about PID, which can not necessarily be caused by sexual transmissions. But let's go now into sexually transmitted diseases and what they do to the chances of fertility.
When you're talking about sexually transmitted infections or STIs, they used to be called STDs before.
No, it's STIs.
STIs.
Okay.
You're talking of infections that are actually acquired. Yeah, a partner acquires from some other source and they have them and then they can transmit maybe to the partner. And the commonest cause of STIs are diseases like gonorrhea, syphilis, chlamydia, trichomonas vaginalis. Those are the commonest that we find as sexually transmitted infections. And what basically they do is they damage, right? They cause damage to the reproductive system. And once they cause the damage, then you find that if it's a lady, then you have tubal blockage. You can also have adhesions in the uterus. They can go in and damage the ovaries. Because in the men, they can also damage the testicles, and they can cause damage to the system itself and cause a constriction in the system. That is basically what the STIs do.
Absolutely.
Yeah.
Quite interesting. I think when we learn that, we get to know better. Are there vaccines against STIs?
Okay, if you look at human papillomavirus, which is also, sort of a lesser STI, and now linked to causation of cancer of the cervix, and also cancer of the penis in men, and warts as well. Yeah. Then you have the vaccines. The vaccines are available
Absolutely.
for both boys and girls, and even in adults. Because you see, for human papillomavirus, you're talking about many subtypes, many strains. Yes, many strains of those ones. So even if they have been exposed because they have been sexually active, they could have gotten some bit of the human papillomavirus and they don't have the others. So that's why now we have confidence in giving even people who are exposed, who have been sexually active, we still give them because it can take care of the others that they have not gotten. Otherwise, it is supposed to be before the onset of sexuality. Yeah.
Wow. Daktari, we have been asked to talk briefly about the effects of diabetes to the female reproductive system.
Yes. Diabetes is not simply a sugar problem. If I start that, because people think diabetes is sukari,
Yeah.
sugar problem. Diabetes is a multi-organ disease that can damage target organs, the eyes, the brain, the heart, the lungs, everywhere. And it does the same even for ovulation. It destroys the ovaries, causes poor quality of the eggs, okay? And even when the mothers conceive, it can actually lead to abnormalities, congenital anomalies in babies born with mothers with diabetes. So right from conception, the quality of the eggs, right? The ovulation itself, right? And then even the growth of the baby. Across the board, diabetes has an effect on the cells. It destroys the cells. So it's not just a sugar problem. There is destruction of the cells.
Absolutely.
Yeah.
We continue this conversation and we'll be shortly coming to maintaining a healthy reproductive system. And we're open to pick up all your calls and continue to answer your questions that are coming in on 22232. I'll also be checking out Facebook in a short while. I have an IUCD copper, but since last month I have a UTI, got medicated, but it occurred again. What could be the problem?
UTIs are very, very common, and they should be checked before you blame the coil. Because coil can also be a cause of recurrent urinary tract infection, especially the bladder, the cystitis, which is also a component of the UTI. They should check their partners also. They should do a culture of that urine. What is causing this recurrent urinary tract infection? And address it, all right? If you have checked everything, you have checked your partner, you have done a culture on the urine, and still it's recurring, then you'll have to remove the coil. Yeah.
Absolutely.
Yeah.
Okay, we continue with some of the questions that are coming in. And now, maintaining a healthy system, a healthy reproductive organs, reproductive system.
Yes.
Yes. We start with
Maintain.
ladies or men.
Okay, maintaining. I'll talk about both parties. Good diet is very, very important. Healthy diet, because if you're unhealthy, your reproductive system is going to be unhealthy.
True.
There will be cholesterol. You'll be overweight. Yeah, your BMI is going to be very high. You'll have other offending peripheral hormones being formed from the fat. Okay. If you don't exercise, then it means that even the blood flow in your system is not good. So having a good diet, regular exercise, all those are important when you're maintaining a good reproductive system. Then, of course, it's good to remember about behavior. Yes, because if you have multiple sexual partners, then you're introducing sexually transmitted infections.
Yes.
Yeah, because once you do that, then you bring in things like gonorrhea, for example. HIV, you have not even mentioned about HIV, which has a role in it's an STI. Right? It's a sexually transmitted infection, which can lead to even cancers, cancer of the penis as well, cancer of the cervix as well.
Wow.
Okay, so behavior is very, very important. You're also looking at personal hygiene. Yeah, so if you don't keep personal hygiene, then you can have infections. Make sure that your mental health is good. Very, very important. Your mental health.
Because you mentioned stress when
Yes,
it
stress.
came to
Yes. Yeah, even sexuality itself, enjoying the God-given rights about sexuality has to do with also good mental health, good diet, good exercise. Okay? And then, of course, there are these checkups that we normally forget. Pap smear. Do you go for a regular pap smears? Do you go for a regular lipid profile, cholesterol checks, both men and women, right? Do you check our blood pressure? Do you do our sugar levels? Are we diabetic? Are we hypertensive? All those are good body checkups regular. And we talk about 2 to 3 years as good time to go and have a full body checkup. That is what I would say to maintain a good reproductive system.
wow. What about fungal infections? Are they transmitted?
No, fungal infection is not transmitted. Everybody, man and woman, you have your own source of a fungal infection. A lady may have quite heavy florid fungal infection. And during intimacy, the man might get in their organ, because of that contact. But it's not now, in part of the sexually transmitted infection because everybody has their bit of fungal.
I remember in primary school, I just got this discharge, and thank God I was close with my mom because it was so embarrassing.
Yes.
Green, and
Yeah.
I'm like, Mom, what's happening to me? And she took me to hospital. They're like, you just must have sat, maybe on a dirty toilet
Yes,
or
absolutely.
something. And so I started being so paranoid.
Yes.
So I get to the toilet first, I wash my hands
Yes.
before going in.
Yes.
I put like a whole layer of
Yes.
tissue on the chair. I put some inside in case there's any sprinkling.
Yes.
Then I do my business.
In fact, at that age, hygiene is normally the issue.
Yeah.
Yeah. Sometimes the young girls, you touch their organs. Sometimes they will clean with anything. They might wash. It's basically a hygiene issue.
Also, not learning to wipe from front
Absolutely.
to back. And that's, I think, something we
Causes,
should teach girls at
because
3.
the main source again is the anus. Because the fungal, you have so much in the food system, from the mouth down the gut all the way to the anus.
Oh, wow.
Yeah, and since the anus and the private area are close neighbors, so it quickly gets into the other portion. And the environments are similar, warm and moist. Because the fungus likes enjoying warm and moist environments.
Wrong panties.
Yeah.
What are those?
Wrong panties. We avoid warm. We want airy panties with nylon-like and polyester-like. Those panties we
Cotton.
want to avoid, and cotton. So we want panties that are a bit airy. Yep.
Okay, so wait a minute, Dr. You said cancer of the penis. It exists.
Yes, there's cancer of the penis, which is related to human papilloma virus. Just like we have human
HPV.
papilloma,
Oh, yes.
HPV, that was related to cancer of the cervix. It's now, both ones are related to sexuality. Yeah, now the cancer of the cervix, cancer of the penis are related to sexuality. Yeah, so it exists.
Wow,
It
absolutely.
kills quite a number of men.
This is the conversation we're having. People only know prostate and testicular cancer.
Yes.
So we're getting to learn much more about this. We are talking about fertility on Health Check. It's only on Hope TV, where you look and live. I encourage you, from wherever it is you're watching this show, to share. Let everybody know that, what are these causes of fertility and how they should support couples. As we continue to pick up the questions, and we're getting all your phone calls, so just keep trying. We're going to be with you shortly. We have about 10 minutes to be answering your calls, and we still have some more time for some SMSs on 22232. How can we encourage couples instead of always asking them, lini, ni nini, mnangoja? Wamama, talking, calling.
Couples, when talk comes to fertility, if you stay for a year
When you're trying.
when you're trying, right? And we know couples staying same homestead and not one couple working far from the other. They're working, I mean, every evening they meet, they're in the house, sort of a family. If that ends up a near, there's no chance, there's no sign of, conception. They should immediately, as a couple, see their doctor.
Okay. I like that. That's very
Yeah.
clear. Talk about weaning off some of the contraceptives.
Yes, contraceptives, there's this notion that some contraceptives cause infertility. There's actually no contraceptive that causes infertility. And there are some contraceptives that can delay. Not that they cause infertility, but they delay. The hormone especially. Not the pills, but the injection, the implant that you put in the arm, and the patch that is normally put somewhere. Those ones are progesterone only. So those ones sometimes can delay fertility because it sort of kind of cause a hormone imbalance. The effect on the body, it takes time for the body to pick up again. So those ones can cause a delay. The coil, I know, is associated with infections. If an infection comes to a lady and they have a coil, it's a foreign body. So it encourages the infection to flourish very quickly, and it can actually go up and cause pelvic infection and cause havoc, tube blockage and all that. So when you're talking about weaning off, so the ones that delay and you want probably to start trying some months, then you may need to stop them earlier. Things like the coil, the pill, those ones you can stop and start trying immediately and you can be sure you conceive.
Why the pill? Why is that?
The pill contains two hormones. It's a combined pill.
All right.
So it mimics the natural cycle. Yeah. This other one is a monophasic. It does only have one hormone.
All right.
And therefore, it kind of causes one effect. Yeah.
Wow, that is quite interesting to know about this. Infertility prevention.
Yes.
What can you say about that?
Infertility prevention, when you look at causes, we are saying that behavior is very, very
Behavior. And we repeated that so many times.
Yeah, behavior.
Yes.
In fact, you find that the pelvic infections, if a couple is faithful, behavior is key. There will be no sexually transmitted infections. There will be no unwanted pregnancies. So behavior is very key. Prompt to getting treatment. If unfortunately someone gets infection,
I like that.
Don't wait. Get prompt attention.
Because it gets worse and
It
worse
gets
and worse.
and worsens.
Yeah.
Yes.
And as sooner as a couple you accept the situation that's going on and
Yes.
see your doctor.
Yes.
That is after a year of
Yes.
constantly trying.
Yes.
As we said, it's 25% chance
Yes.
a month
A month.
for couples. So
Yes.
after that 1 year, just go see the doctor.
Go and see the doctor.
Pray.
Yes.
We say pray. Yes.
Yes.
So when Paul prayed and they got children. But also go see your doctor. Now we have the help.
Yes, and get the right treatment, because some people don't get the right treatment and they get the treatment that doesn't find, therefore which is not okay, and that normally worsens the issue.
Upsetting
Yeah.
Spacing pregnancies. What are some of the things we need to consider?
Let me say this. The issue about spacing pregnancy is just having a break. Pregnancy has far-reaching consequences on the lady and also as a couple. You can, you are pregnant the first trimester, you're vomiting, there's nausea, there's all that, you can't work nicely. Then you're over with the first trimester, the first 14 weeks or so. Then you go back, there's the heaviness, your blood pressure is low, you can't eat well, you can't sleep well, Then you finally have the baby. The baby's like crying at night and feeding at night. So you are, mentally disturbed during the day, during the night. The baby is crying, it's waking up, babies are getting sick. The other 5, they're always seeing the doctor, they have diarrhea, they are coughing, pneumonias. That's stress, all right? So you need to, and also the baby needs a lot of attention. So when you look at yourself and you're looking at the baby, then you need to have some time
Okay.
To have some rest.
Yeah.
Okay, there are people who even get after 1 year,
Yeah.
which is normally it's
Stairs.
okay. Yeah, but we normally say 2 years is good time to space because the other baby you'll now be weaning off breastfeeding. There's a baby that someone that can accept somebody else to hold, to help.
Now you can repeat.
Yeah. Now you can now look into now having a second born, and you have even more time with this because this other one now has even other activities
To do.
They may not be just mom and mom. They also dad. There's a house girl. They also
Yeah.
Yep.
Okay, George in Kahawa West. Thank you for calling us. George,
Hello.
how are you?
Fine, thank you.
Uko na swali gani?
Nilikuwa nauliza
Yes.
huyo daktari anatapatikana wapi niende kliniki yake? Niko
Oh,
na
okay,
issue.
daktari anapatikana wapi uende kliniki yake? So many people are asking and I knew this would happen. Aya, tutakusharia but amesema ako Kenyatta Hospital but also Savannah.
Yes, Savannah Hospital on Mara Road.
Yes.
Yeah, on Mara Road in Upper Hill.
Upper Hill, Mara Road, Savannah Hospital.
Yes.
Awesome. We'll share that again. So Savannah Hospital, Mara Road. Can we call? Is there a website we can get your number or your secretary?
They can just Google.
You can Google, yeah. When you go to Google, there's a number you can call. So Uncle Google, atasaidia sana. Biological clock is ticking. What is the ideal age one is supposed to conceive? Please advise, hii pressure ya kupata watoto is too high for me.
Now, we normally look at 35 years going forward. Yeah, 35, 36, 37, there are issues. But it's not really a rule of the thumb because I see most patients 37, they're still getting the babies very well, but now it starts to reduce. By age 40, they're saying even now the eggs are fewer, the eggs are older, even that possibility of those eggs, the conception happening is harder. Okay, but we still see 42s, 43. But if one can be really organized and by age 35 they had enough, children, that would be much better. Yeah.
Can someone use IUD if she has had a CS and no other method is working?
Yes. In fact, sometimes we insert an IUCD during cesarean section.
Oh, wow.
You remove the baby and institute the IUCD.
So that the 2 years can happen.
It's quite a safe method.
Oh, wow.
IUCD insertion is uncomfortable. Yeah. In fact, the ladies, you have to talk to them, you have to counsel to them, you have to guide them that when you're doing this has to happen. Please do this because it's sort of uncomfortable. In fact, it has a very bad name among, among people. That's a very painful thing. But of course, now during cesarean section, one is either you have the local, the regional anesthesia or the full. You can now easily put in a coil. So it is quite safe.
Okay. What is an implanon?
Implanon is an implant.
Okay.
Yeah, implants, and right now you have two in the market. You have Jadel that goes for 5 years and Implanon for 3 years. They normally put in the arm that, normally the left because most people use the right. If they use the left, then you can put on the right. At the right upper, on the inner part, upper, then you put there. It's normally one rod. Jadel is 2 rods. Small plastic rods that you insert there. And they are micronized, so they keep, releasing the hormone in small doses, in small pulses. And they are timed either 3 years or 5 years. Implanon is for 3 years.
Okay. And the previous question? One is saying, but I was told by a nurse to avoid patch contraceptive so as not to struggle to conceive when I'm ready. How true, Daktari? I think you've just commented on that.
Yes.
Yes. My name is Jackson. Where will I get that doctor, please? Wow. Savannah Hospital, Mara Road. That's in Upper Hill. You can also Google Savannah Hospital and you get the details and book an appointment. Thank you so much. Keep texting your questions. I think you have space for 3 more questions. As we were continuing, I think we were actually in a conversation and the question we were asking is spacing. Did you wrap that up?
Yes, I did and said about 2 years is normally quite.
About 2 years is very good.
Yeah.
As we look at this and we've shared, you talked about primary and secondary infertility.
Yes.
Could you just explain that one more time? I think someone was asking the same.
Yes, primary is whenever a lady has conceived. whether it ended up as a miscarriage or they got a baby or get an ectopic pregnancy. It's still a conception. So if you have never gotten pregnant, it's primary infertility. If you have ever gotten pregnancy, whether ectopic or miscarriage or a baby, secondary infertility.
Okay.
And you have tried for 1 year.
Faith is asking, now what medicine then can we use to boost fertility?
There are several medicines like the area one that was mentioned, Clomid. There are also other, like letrozole. There are also other products that are mentioned that are in the market. They boost fertility. Then, of course, there's the IVF. Yeah, for those couples who have difficulties in vitro fertilization, there are quite a number of injections and a combination of drugs. And boosting fertility in such a case in IVF is quite complex because you are saying, in a layman's term that you're getting the eggs from the lady and the man is bringing in the sperms and they are kind of in the lab and joined together. And once they achieve a certain size, that conceptus after fertilization, and is put in the woman's womb. Yes. You also have IUIs, intrauterine
How does it
insemination.
attach?
It's by growth, it's natural growth. The fertilized egg has potential to kind of produce finger-like projections to attach. That's the way it is made. It's very, very aggressive. And that's why sometimes they say it grows like a cancer. It's like a parasite. Very, very aggressive. It produces some finger-like projections and burrows into the uterus to get blood now. So that's, and you remember during pregnancy, a good chunk of the blood goes into the uterus to supply the uterus, and they get hold of that blood and they keep growing.
Wow.
Yeah.
Hey, this is serious. And that's why you can give an egg to someone else to be a surrogate.
Yes, you can. You can. And at age 41, we encourage the ladies to get eggs from other people. Yeah.
And still carry or
And
give
still
someone-
carry.
Okay.
And still carry, yeah. Yeah, for surrogate is a lady who has uterine problem. They are unable to carry. Either they will remove the uterus. These days, you are having another tendency. Some ladies don't want to carry babies. Yeah. So they can actually get their eggs and get a mother to carry for them. It's happening.
Okay. No comment. The conversation has been on fertility, and I was getting some of your questions that probably were not passed through, and there's one I didn't get clearly, but you could keep sharing those questions that came in on our call line. You have about a minute. If you have an urgent question you'd like to ask us, go ahead and do that. The conversation on fertility right here on Health Check. We need you to share this video and let everybody get to know this information so that they can be wiser as they encourage, support, give whatever help they can to couples who don't have children yet who are looking to have children. Of course, I believe in the power of prayer, and I believe that, at God's time, He does, do a miracle. But also, adoption. There's so many kids who need a home, and your home would be ideal for them. So I think that's one of the things that, by the grace of God, I hope to be able to do and give someone who might have never had an opportunity to have a certain life, that life, by the grace of God. What did you comment on the same?
In fact, we use it as an option.
It's an option.
Yes, when you're talking to the ladies, because sometimes they come, doctor, we're looking for a baby boy. You have 4 children, you're looking for a baby boy. Yeah, there's no guaranteed way of getting a baby boy, right? So we tell them,
Are you sure? Doctor, you have heard there are ways.
there are ways, but they're
They
here,
they
no
said
there.
there's this time, there's
Yeah.
this thing you see, there's a certain position.
All those are maids.
Oh, that means, oops.
Yes, or people come, they were done tubal ligation. You cannot reverse a tubal
What is
ligation.
tubal
Tubal ligation is when it's a family planning method that's permanent. You chop off the tubes, right? And then years to come, we need a child. Yes, they cannot afford IVF because IVF is expensive. You're talking about 600,000 Kenyan shillings, and you're not guaranteed of success. All right? So you tell them, adapt. So adoption is a known option of solving fertility problems.
Let's talk about unsuccessful IVF, because recently, and it's shared, someone lost a 2-month-old baby.
IVF, I would say it's about 2/3. So you're talking of about probably 55%, success rate. Yeah, it depends from center to center. So there are centers maybe 60, there are even other centers below 50. Yeah, so you can see anything that's not 100% has a chance of failing. And why do they fail? There are so many reasons, because it's really a very delicate process, very intensive process in terms of follow-up, in terms of medications, in terms of what to do and what not to do. All right, that's why it fails. So it's not 100%. You're talking about 46% in some centers, 50%, 55%.
We talked about reversible family planning.
Yeah.
And let's just talk about the vasectomy for a second.
Yes, vasectomy is sort of a contemporary of the tube irrigation in ladies. So you're cutting off those tubes that we say transport the sperms during when they are needed to come out. And it's a method, it's one of the permanent methods. The permanent methods are two: tube irrigation and vasectomy. But of course, it's been having very, very poor uptake. We're now getting men, agreeing to discuss vasectomy. But what I also find it quite strange is that the ladies, you defend the men. So when I'm counseling some couple about family planning methods, it's a couple that sort of has attained their family size. And I'm saying we can have permanent options, and there are two. And I'm saying you can have tube irrigation, and these are the pros and cons. You as the man can have vasectomy. Yeah. And I mean, it's kind of saying, yeah, I think
No.
no, I mean,
Let's talk about it, because I don't know where I got this idea that vasectomy after 5 years, something can change about that.
something?
Something can change about vasectomy after 5 years.
No.
It's permanent.
It's permanent.
Okay.
Yeah, unless you try again to reverse, which is very difficult. It's
Yeah.
really less than 50%.
Wow. So that was, there's a couple that has been trending, and we've been looking into that story. I think we need to wrap this up with just what you'd share to families. And I think we start from a point of encouraging,
Yes.
and also go to the point of discouraging people from, dropping their noses into people's houses. And then, and general health care.
Yes. What I would say is that most of the fertility issues have answers
Yes, I like
and have
that.
solutions. And we know that it causes a lot of psychological issues.
Yes.
Yeah.
Actually, as you answer that, there's Dennis from Nyeri, and he's called so many times. Can we pick his call?
Yes.
Okay, Dennis from Nyeri, thank you for calling Health Check.
Okay.
Uko na swali gani?
Okay, niko na bibi.
Uko na bibi, ehe?
Haya, bibi yangu ikiwa na period
Ehe?
ina bleed sana.
Ehe?
Hata sasa amebleed sasa, sasa hii ni mwezi mmoja. Sasa alikuwa anataka usaidizi, niulize shida ni nini. Juu siku daktari alikuwa TV, nikajaribu aiki, nilikuwa nataka niulize swali.
Okay, ati alikuwa kwa TV gani?
Yeah?
Daktari alikuwa kwa TV ingine?
Alikuwa kwa nini, kwa TV, alikuwa anaonyesha kwa TV, alikuwa anaongea, alikuwa anahojiwa.
Okay. Sawa, acha nimuulize. Poleni sana, lakini asante kwa kupiga kwa niaba ya bibi yako.
Okay, asante.
Okay, sawa. David from Nyeri, his wife has been having a period for a whole month.
Yes.
What can you say to her? What does she need to do? She's in Nyeri.
Oh, a period for a whole month. We need, hormone imbalance, of course, carries the day. But is she on any family planning? We need to know that, because some of the family planning methods can cause prolonged polymenorrhea, prolonged periods. We need to check her. Has she done a pap smear? Can be a lesion at the cervix which is bleeding all the time. Does she have fibroids that are located into the uterine cavity? Does she have polycystic ovarian disease? What is
There's so many things that
There's
could
so
be
many
leading
things
to her bleeding.
to her bleeding.
Which
So,
gyna can she see in Nyeri? Her husband is very supportive, and I'm sure he'll take her.
Yeah, she can get my number, but there's a doctor that I use there called Juma Mwangi. He can look for Juma Mwangi.
Yeah.
If Dennis is listening to us,
Yes.
please get in touch with Dr. Juma Mwangi.
Where is
Be
he?
able to
In Nyeri?
sort you out. He's a Karatina
Karatina.
in a Karatina
Okay.
hospital. Yeah.
Dr. Juma Mwangi. I hope you can find him. And I'm sure you'll find him. If you just ask someone who knows somebody, they know him. But let's wrap this up because we have about 3 minutes.
Yes.
You are talking about fertility problems have a solution.
Please, listeners and all couples, do not be stressed. Don't get depression in your house because you cannot get a baby. There are solutions, all right? There are solutions and you should be able to get a baby. If you cannot be able to get a baby, kindly embrace adoption. Adoption is a recognized way of having a baby, all right? And then when we are dealing with infertility cases, we like involving also psychologists and counseling because it's an issue, and especially for the ladies, because most of the men, if they realize a lady cannot able to get a baby, we always see that tendency is just cut and the lady is left really, really down. But we need support, yeah? Family support is very, very important. But my key issue is no lady who is responsible for fertility issues. There's no man who is responsible for fertility issues. It's a couple issue. And if one of the persons is found to have the problem and the other one is normal, please let us support each other. Because in the first place, we did not love each other because of baby.
That's true. And if you did, that's a wrong reason.
It's a long reason.
Yeah.
Yeah.
Wow.
Yeah.
Thank you so much for that advice. I just love what Dr. said, that fertility problems have a solution and adoption is also a recognized way of having a baby.
Yes.
That's quite interesting. We never look at it that way.
Yep.
Thank you so much for your time. As we said, you can find him at Savannah Hospital. That's on Mara Road in Upper Hill. And he also, sometimes if you meet him on the corridors of Kenyatta Hospital, he's there to do his trade and serve people in that particular way. I also keep urging you to share this video because there's somebody in your timeline who needs to watch it. There's someone in your WhatsApp group who needs to watch it. I assure you there's great programming lined up for you right here on Hope TV where you look and live. Melissa Odward is coming, of course, with News Watch at the top of the hour, then Chiriku, and you continue on tuning in. I'll see you tomorrow on Team Worship Wednesday on Hope FM with George Gishuru, where you listen and live. Until then, have a lovely evening. And Daktari, asante
Thank
sana.
you. Thank you so much for
Awesome.
having me.
Aya, bye.
Thank you.